So my current roles are as referral liaison and as a clinical optometrist in a couple of the BEI clinics seeing post-op patients. I'm going to mainly focus on those two roles because I'm fairly sure you mostly know what it's like to be an optometrist in private practice. So I'm a Sydney girl. I went to the University of New South Wales to do my bachelor degree and later my master's degree. I've popped in there that I was involved with the preceptorship program, which is an internship. They sent us to the State University of New York for 6 weeks in our final year of university, and I found that a very defining moment. Prior to that, I was not overly confident seeing patients in the clinics, but when we went there, we were thrown in the deep end and had to see many patients every day using examination techniques, which were probably a little bit ahead of what we were doing at the time. So I came back a much better student optometrist than what I left. So I have previously had a range of roles. I've worked in private optometry practice. I've worked in corporate optometry, so yay OPSM, for about 10 years in the city, and I also locumed with, they used to send us out to different OPSM optometrists to help locum for them. So I've worked everywhere from the city out to Katoomba, in regional areas like Port Macquarie, Canberra, Tasmania. So it's really helped round out my my knowledge or understanding of what different optometrists go through when they're trying to manage and refer patients. So it's helped me in my current role. And as Karina said, I have also supervised at the university for a time. So just a bit about my referral liaison role. What it basically is to provide a bridge or a point of contact between the Vision Eye Institute doctors and clinics and our referring optometrists. So it's a two-way flow of information. I go out and give information to referrers, and in return, we find out, how they're finding, the referral process, what's working for them, or what we could do a little bit better to streamline the referral process. So part of my role involves organising our educational events. So we have an annual conference, we have in-house seminars and regional seminars. I was in Terrigal last week and going to Canberra tomorrow to help run and those events. I do practice visits, so again, going out and visiting optometrists. And we also do email updates if we have events such as new doctors starting or new surgeries that we're providing. So again, it's about providing information about the doctors, their services, the clinics, the different procedures and technology, and also about shared care or co-management arrangements. So I put a picture in there of my portable office, my car, because on any given day I'm working from it. I might do one or all these activities, and my schedule has to be quite flexible. My clinic days are fixed, but on the other days when I'm doing my referral liaison work, I might be out visiting optometrists, I might be running between our clinics, meeting with doctors or management, I might be planning education events or doing administration, or just answering referrer inquiries as they come in. So I have my mobile phone, my laptop, and my little red office, and off I go. And I find it really stimulating and enjoyable to work like that. So yes, out of necessity, my schedule is quite flexible, and sometimes it is stressful, like there's a lot of balls up in the air at once a lot of the time. I write lots of lists. Sometimes there's deadlines or I have to troubleshoot an awkward issue. But again, generally it's all very satisfying. So my clinical optometry role, again, involves seeing post-operative patients. We examine and counsel the patients so the doctors don't have to do that. The doctors are generally available if a patient needs to see them. And they are mostly refractive patients, cataract patients, but we also see pterygium and glaucoma patients, as well as collagen cross-linking and post-corneal graft patients. So again, I got into ophthalmology about 12 years ago after my stint working for OPSM, just looking for something a little bit more challenging. At the same time, I was doing my master's degree, and so, it sort of just pushes you up a higher level. Similarly, like I was working in the Vision Eye Institute clinics for about 8 years before I took on the referral liaison role. And again, I've had to do things like presenting, organising events that, 2 years ago were not on my radar. They were buried, they were down out there. So it is, you push yourself, you do new things, and slowly but you grow and you're capable of a little bit more. So just within the clinics, we do use a little bit of specialised equipment. The Optus and the OCT you'd be familiar with, but we also get to play with the 3D topographers, the specular microscope. We've got the biometry devices, the A-scan and IOL master, which mostly the orthoptists use, but occasionally we have a play. And we also have a device called a Varion scanner that the doctors use for cataract surgery. So there is time for a life outside of optometry as well. Again, I have to be flexible. We do a lot of after-hours events and things, but in my spare time, one of my passions is dogs. My sister has Siberian Huskies, and we get to take them sledding once a year in the snow. I also got involved with the Husky Club's rescue program. So the dog there with the puppies was a pregnant female that was rescued from a pounding casino. So I organised for her to go to our foster home in Canberra, where she had her puppies, and they'll all find good homes. So again, I have time to partake in a lot of family events. I have a massive family, and I'm going to a family event after this actually. So there is time for a life outside of optometry. So the future of optometry, well, it's always going to be a primary care profession. People come into your practice off the streets generally, and they'll sort of have an issue and they won't know whether they need, behavioural optometrist or a specialised contact lens fitting. So our first and primary role will be to examine those patients, talk to those patients and find out what it is that they need. I see a rise in specialised practices. So the specialty contact lens fitters, behavioural optometrists. I've seen a few clinics that specialise in the treatment of dry eye. So I think, as people strive to improve themselves and get involved a little bit more, you'll see more of these types of practices. I think you'll also find there's more grouped independent practices. People don't like to be isolated, so having those groups of practices, it gives them a sense of family, and I think it's much more satisfying to work in those conditions. And I think you'll see an increased number of therapeutic practitioners, and also the expansion in the range of conditions that are treated with therapeutics as optometry grows more comfortable with it and as legislation expands to include that. So my clinical pearl would just basically be never be afraid to ask for help, be that with, patient care or, where do you go next in your career. Talk to your colleagues, talk to managers, talk to doctors if you need to. Most people are generally quite happy to offer their advice and help. So thank you, that's it for me.